Hello there, everybody. This is Dr. Goldner from Goodbye Lupus, and it is time for our weekly live Q&A. I feel like we need a theme song. Da, 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 da. My reasons for being here are to help you help the public, and I've been scheduling these into my calendar since the beginning of the year, or actually the end of last year, to try to give back as much as I can to help all of you figure out the best way to get as healthy as you can and answer questions and clear things up. There's always things that come up. So while this can't substitute for your seeing a doctor and getting medical help and diagnoses, obviously I can't see you and I can't treat someone that I can't see. I can help you with understanding more about disease, about health, about healing, about nutrition. So that's what I'm here to do. And I was trying to think of a topic for today, and I usually base it off of whatever kind of struggles or issues have been happening that day. And the biggest issue I've had today actually has been from medical professionals, honestly, drawing really, what I consider to be incorrect conclusions. One of the biggest things I work with my own clients on, so for people who are in my rapid recovery programs where they have to work with me every day, one of the biggest things that I help them with is not drawing conclusions, because usually, as humans go, when we try to draw conclusions, we're wrong a lot of the time. We assume that because something happens, it's connected to something else. And if we make the wrong conclusion, it could lead to the wrong action, which can then lead to your health getting worse. And so I've been seeing that today, and it hasn't been from my clients. It's been from doctors. And so that's been my biggest frustration today. So the examples I have today is one, I got off the line with someone who has a child who's very sick. And they tested his blood vitamin C levels, and he was low in vitamin C. And so the doctor told them that he's not absorbing nutrition properly if he's low in vitamin C. And I said, what if it's the opposite? Vitamin C is necessary for cellular repair. So what if his body is trying to repair damage so quickly it's using it up? Right? That's a totally different idea, right? So does he have a malnourishment syndrome, or does he just need more because his body is using everything it's getting? So we have to be careful about how we draw conclusions in medicine. Thankfully, that won't change the game plan too much because he needs more vitamin C dense foods. He has nothing to worry about working with me on that. But how we interpret things really can have an effect. The one that scared me more today is someone I'm helping in rapid recovery who has Crohn's disease and COVID at the same time. And COVID can make bowel symptoms worse. In fact, I've had many people that have seen me where their primary symptom of COVID was all diarrhea. And when you have Crohn's disease and your primary symptom tends to be diarrhea, that can be confusing. What is it? But the problem that I'm having is they tested his inflammatory markers and they're high. So they told him that you have a Crohn's flare and that he should come to the hospital for immunosuppression. The problem is he's still testing positive for COVID, which can cause high inflammatory markers. That's one of the reasons why people have long COVID and other issues and severe issues from COVID, is because it stimulates the inflammatory immune system. So high inflammatory markers could also be from COVID. And guess what happens if you have an infection and you take immunosuppression? It could make the COVID worse. He could get sicker. So this has been my frustration for the day. And it's something I want to bring your attention to, that not only do just random general folks make incorrect conclusions about health, but even physicians make incorrect conclusions about health. The problem is when they do that, it is much more dangerous to the people that they're treating. So that's just on my mind today. And I thought that I would share it with you. It's very important and what I said to this person, because I can't take over his medical care, is just to say, ask your doctor, why are you assuming that it's Crohn's versus COVID? Why are we choosing this pathway? Is it possible, that it could be this? And what will the impact of taking this be on my health? It's very important. And I just see it all the time where docs will jump to a conclusion. Maybe you guys can relate to this. Anybody here who has autoimmune disease and you go to your doctor and you say something hurts and they go, oh, it's just autoimmune disease, and they don't even test you to figure out what it is. That used to make me so frustrated when I had lupus all those years. if I had any new symptom and go to the doctor, they would say, oh, it's just lupus. And I'd say, do you want to test me? Do you want to do a test? Do you want to do a scan? Why do you just assume just because I have a diagnosis here that I can't have something else? And that was a very frustrating thing, is that they don't take the time anymore. They don't take the time to listen, and they don't take the time to really consider things. And it's not always doctors' faults, because most of the time they only are allowed to have 10 minutes with you anyway. I spend hours with people that I work with to make sure I hear the whole story and come up with all the different possibilities rather than jumping to conclusions. But anyway, whether you're a doctor listening right now or anybody else, try not to jump to conclusions. Just deal with the symptom at hand, see what you can do to help yourself, right? But try not to jump to conclusions. The conclusions I see of kind of lay people will often be, I've been on smoothies for a week, but I just got a recent cholesterol test and it's high. Why is this smoothies causing my high cholesterol? And I'll go, they're not. They're not. You have high cholesterol and you've started smoothies. Keep doing those. Take away other foods that are causing high cholesterol. Keep going, right? So conclusions are dangerous. And that's why you want to have somebody who truly understands the impact of nutrition on health to be involved with making those decisions and helping you with those conclusions, because that is one of the things that I see really hurt people, is they draw the wrong conclusion and then they'll say, oh, this isn't for me. And then they rob themselves of recovery. Okay, that's what's on my mind today. It was, that's what I'm worrying about today. And maybe that could help you as well. Okay, what I'm going to do is, remember, this is live streamed across Instagram, 2 Facebook pages, and YouTube. So I'm going to go back and forth between the 3 different modalities and make sure I get questions from all the different areas. If you can let me know, if you're asking me a question about my protocols, please let me know if you're referring to hypernourishment. You can write HN, Goodbye Lupus Protocol, GLP, or the Goodbye Autoimmune Disease Protocol, all right, GIDP. That way I'll know how to answer your question, because sometimes the answer will be different depending on your goals and what you're trying to do. So if you can help me out with that versus it being a general question, that can give you a more specific answer. Okay, so let's go over and look at what YouTube is doing today. Okay. All right, Purity and Plans wants to know if there's an example of someone whose vision improved on the protocol. We actually see that all the time in my rapid recovery group. It was one of those amazing side effects of the nutrition that we never expected, but we see it in every group. So right now we're in a group that's only, they're just partway through their 2nd week. So they're mostly just getting over detox right now. But usually by halfway through the group, between 3 and 5 weeks, we will have people tell us in every single group, oh my gosh, I don't need my reading glasses. I'm reading street signs better. So we see it on a regular basis that people's vision improves, in addition to different kinds of itises. So uveitis or different blepharitis, different kinds of itises, which are, again, inflammation. Eye diseases get better, but vision has gotten better in every single group as well. All right, let's see over here what Facebook's asking me. All right. Let's see. All right. Well, Pamela in Facebook just wants to know, peanut butter, is it healthy? Well, sometimes. So what I'll say about that, it depends on your goals. So if you're going to eat a peanut butter, make sure the only ingredients in it are peanuts, maybe salt. That's it. A lot of the peanut butters people eat are actually full of oils and sugars. So if you're getting Jif and Skippy and all those ones in the supermarket that are, of course, marketed towards children, they usually add excess other oils in it, and they add sugars as well. Those are always unhealthy. Don't ever get them. Now, if you're going to your health food store and you're getting the fresh ground peanuts into peanut butter, that is a much better choice. And listen, nuts do have some good components in them. They do have, for example, minerals in them, and there's some vitamins in there. And so they can be a part of a healthy diet. I have peanut butter in my home that my kids will have sometimes, or my mom. And it's just peanuts, right? It's peanuts and salt. They're only ingredients there. So if you're healthy and you want to have some nuts, nut butters in your diet, you can totally do that sometimes. Now, if you're trying to get healthy as quickly as possible by raising your omega-3 to omega-6 ratio, well, then you want to make sure you take that out, because peanuts do have a pretty high omega-6 to omega-3 ratio, and that's going to slow down your ability to actually correct that. Okay, let's see what Instagram wants to know. All right, let me scroll back down. You guys filled up my feed here. One moment here. Let's see. All All right. Whoops. Now I moved my camera. One sec. All right. And the same answer for the Real Home Chica about nuts. Same answer. Make sure they're not roasted. Raw is the way you want to go. All right. Let's see. So healthy happy habits, healthy happy habits with HJAS. You guys are trying to test my my tongue and lip exercises today. Okay, is it okay to have a cup of flax oil a day and can have as much nutritional yeast as I want? If it's a cold pressed flaxseed oil, and your gut can handle it, then yes, you can have that. I think for most of us, a cup of flax oil is going to lead to explosive loose stool. That's a lot. But people who tend to be on the constipated side tend to be able to use it more and not have everything fly out of their colon. So if your colon can handle it, there's no downside nutritionally to having it. Absolutely, it's fine. Nutritional yeast, yeah. I mean, when people ask me, can I have unlimited amounts of something, then I start to wonder what they mean, right? So how much nutritional yeast can you have in a day? I mean, most people, I think in a dressing or something, a quarter cup or so a day is probably what you're going to have. When you say, is there an unlimited amount? I start picturing like a mountain of nooch. So I've never tested to see if there's an upper limit for nutritional yeast. But for most folks who are having it as a seasoning, there is no problem. And I know there's some controversy around that. But in terms of results, remember, I never speak towards theories. I just speak towards results. So in the results of my programs, people tolerate it just fine. Some people do have sensitivities. So if you're using it and you're not getting results, then I would take it out. But yeah, I can't give you an amount. But like I said, it just makes me start to wonder, what are we talking about here? So, be reasonable, like a tablespoon, couple of tablespoons, quarter of a cup. I don't see there be an issue if you're not sensitive to it. But if you're, using it as your meal, maybe. There was one study, and I think this is where some of the controversy comes to. There's different reasons why people don't like it, but again, in terms of results, I haven't seen a problem. I eat it all the time because it tastes good. They did a study looking at inflammatory bowel disease where they saw that putting nutritional yeast in the colon caused inflammation in some subjects. But that's putting it directly on the colon, not going through the digestive tract the normal way. So based off that, there was a suggestion that people with inflammatory bowel disease probably shouldn't use it. But then again, all you really know for sure is you shouldn't put it up your rectum. But because of that, I say, okay, if you have inflammatory bowel disease, probably better not to use it at first while you're trying to get your symptoms under control and then test it. But again, it's pretty wishy-washy. That's why I like results better than theoretical stuff. Okay, let's see here. Okay. So Judith, I've been following the Goodbye Autoimmune Disease protocol for 3 weeks to reverse my lupus, and I already see improvements in my pain. That is wonderful. Everybody give a thumbs up for Judith. That's awesome. I also have candida overgrowth and SIBO. Has anyone reversed those? Okay, yes, absolutely. So these are different issues, right? And sometimes you do need to do something about the candida separately from this. So for example, I had somebody who reversed her autoimmune disease. She had lupus and pleurisy, quickly reversed her autoimmune disease in my group. She went from the ICU, the couch, unable to breathe without pain, to running, went back to school. It was just wonderful, right? Now, she finished and was lupus free, came off of her steroids and everything, functioning wonderfully, still had some bloat. Turned out she had candida. So she completely healed from her lupus, let me say it this way, she reversed her lupus completely, negative labs, off medicines with the protocol, but still had bloating because she had candida. So those are separate. So with the candida, then you have to look at, okay, one, if you're doing candida treatments, then you can also do a low to no fruit version of the Goodbye Lupus protocol as well. And that way you won't feed the yeast, and that works out just fine. Lots of people are diagnosed with all sorts of bacterial issues in their gut. SIBO is a big one I see now. And I haven't really done anything differently in those cases, and they've worked out just fine. There are some people who they get diagnosed with SIBO and then they need to take antibiotics, but then we have to give them probiotics because the antibiotics can be too much. And So, that's something that you can track separately, but it won't change what you're doing in terms of nutrition. If you are eating optimally the way you are, if you are on the Goodbye Autoimmune Disease protocol, then your gut bacteria will get better too. And that's the most important thing. Okay, let's see here. Facebook. Okay. So make sure you actually write the question. I see someone who wrote, I have a question, but you write the question down for me, okay? Okay, let's see here. All right, this is an interesting question I haven't seen yet. How do we know whether we need to take a B12 injection versus a supplement? The easiest way to know this is you take the supplement and it doesn't work, right? So there are some folks who have a deficiency that does not allow them to absorb B12 properly through the digestive tract. You need a protein in your gut to connect to it to allow for proper absorption. Some people just don't have that. Or for most people who have that issue, it's something that happened as they get older. So if you are taking B12 supplements and you continue to have anemia, for example, and it's a certain type of anemia with large blood cells that you would see in an MCV reading. So your MCV on your CBC, MCV on your CBC will be on the high side, usually indicates B12 deficiency. So if you're taking a B12 supplement and that's not going away, then you need to take an injection. There's ways also to look, because sometimes people are taking it and you can see the blood levels rise, but there's other markers that show it's not working. So you can check other things like homocysteine levels. There's different tests your doctor will know how to do to test to make sure the B12 is doing what it needs to. So even if your B12 looks normal on a blood test that just looks at that number, but these other tests are not looking right, like your blood cell size, like homocysteine and other tests we can look at, if those are still abnormal, then also we'd recommend that you use the injections instead. So it just bypasses the digestive tract and makes sure it goes into your system properly. Okay, let's see here. All right, let's look at Instagram. So, sorry about that. I'm going to unplug my plug here and try not to just ruin this whole system. Okay, maybe I won't. Okay, it says, so Ellen Bunt wants to know, there's so much confusing information out there with healing autoimmune disease. All greens or paleo, meats, fruits, it's so confusing. I know. That's why I do these free Q&As with people, is because I want to make sure that you get the best information and know that it's coming from a place that's purely altruistic. I myself am a survivor of autoimmune disease and not just something mild. It's always entertaining to me when someone's like selling all sorts of supplements and diets and they're like, yeah, I had some aches and pains and a little bit tired, and then I did this thing and now I'm better and you should follow me and buy all my supplements. And I'm like, yeah, no, 30 years ago, I was told I was dying. I've had, late stage kidney disease. I've had chronic arthritis. I lived with lupus for 12 years. I had antiphospholipid antibodies and mini strokes. I know what it's like to have real autoimmune disease that is trying to kill you for many years. All right. And I'm passionate about making sure that the information that I give people is results-based. And it's not something that's just like maybe helps some people, not other people. It was one of the biggest reasons why even after I got better, my husband and I did not release the protocol immediately, because we wanted to test it and make sure that I wasn't better in spite of some things, or, you know what I mean? So for example, I was talking to somebody years ago who has made a lot of fame for herself in saying that she reversed MS, and her diet is a paleo type diet. And we talked for a while. She actually messaged me and asked to talk, and it was a wonderful conversation. And we agree with a lot of things, like about self-care and about eating tons of vegetables. And, she told me that she's a physician as well. And she told me that she originally changed over to like free range meat, thinking it'll have less inflammation, but she still had her symptoms of MS. And then she was eating tons of vitamins. And so she said, oh, I wonder if instead of eating vitamins, if I would just eat the source of the vitamins, the vegetables, maybe that would work better. And it was only once she got over like 8 to 10 cups of vegetables a day did the symptoms start to get better. But her protocol includes the meat, even though the meat didn't work. And when we talked in detail, she said, listen, I'm not 100%, But I used to be sitting in a wheelchair. Now I can get on stage and talk for an hour or two, but then the rest of the day I have to sit. So it's like, it's a wonderful improvement. I'm very happy for that. And if people can get that level of improvement, who are, you know, to go from a wheelchair to be able to talk for an hour or two standing up and then have to sit down, that's still dramatic and wonderful. Is it optimal? Well, you know, the biggest question I asked her was, did you ever test taking the meat out to see if you could get even more results? And she said, no, I never have. That's the next step, right? So I'm not here to play a game of who's right. And it's a frustrating thing and actually a hurtful thing sometimes when I see other folks who, you know, they have their own thing that they're teaching, and without even testing or trying, they'll just start to try to decide how everybody else is wrong and want to elevate themselves to first place. I have zero interest in that. My interest is in helping the public get as healthy as they can, because it is a horrific thing to live your life constantly sick and in pain. I know it. I did it from the age of 16. I was diagnosed 30 years ago. And to me, this is about people getting to live their dreams, to live their lives, to get to, you know, get married, have a career, do all the things they want to do and not have to suffer every day. So it's also why I'm willing to adapt. The way I taught my protocol in 2015 is not identical to what I do now, because I've worked with thousands of people now, and I optimize and I grow. And when I learn more, I do better every single time, you know? So I understand the confusion. And the thing to understand is there is a spectrum of how nutrition affects cellular function. So my specialty is understanding the impact of how nutrition affects cellular function, cellular repair, your body's ability to fix itself, and optimal immune function. That's what I do, all right? When you optimize the nutrients for those three things, you get disease reversal, you get optimal health, right? So once your disease is gone, you can just be healthier. So it's amazing to me, at 46, I'm healthier than most people half my age. I'm definitely healthier than I was at half my age, right? That if you continue to take very good care of your cells, they continue to take very good care of you. So when you're looking at the spectrum of things, absolutely, hands down, if you go from a standard American diet or Western diet, because now it's not just American, but if you go from a standard Western diet that has processed junk, tons of dairy, you know, you're eating tons of processed meats, breads and you know, fries in oil and, you know, all this stuff, chips and all that. You're eating all that junk, and you move from that to like an autoimmune paleo diet, right? Which is basically just, you're doing fresh fruits and vegetables, mostly more vegetables and fruits, but like fresh fruits and vegetables, and what they call free range meat. So meat that's not from factory farms, where the animals tend to be a bit healthier. The meat tends to be a bit healthier. They take dairy out and they take processed foods out. If you move from a standard Western diet to that, you will get healthier. Of course you will, because you've taken out a bunch of the poisons you were eating, the processed foods, the dairy, right? You take out that stuff and you eat more vegetables and you eat a healthier meat. It's not, there is no healthy meat, but you eat a healthier meat. You will get improvements in your health. You will. Now, is that enough? Depends on the person. For some people, and this is why they get very, you know, vocal about it. For some people, it is enough. They had more mild disease. They did that and it worked for them. I am grateful and happy for every person who gets better, whatever it is that worked for them. That's why when someone says, I did this and it worked, I'm like, great, live your life. I'm happy for you, right? It doesn't need to be my way. But for many people, that's not enough. And for some, unfortunately, I've seen people who are plant-based that still had symptoms because they needed better nourishment, like on my protocol, but their doctor said, no, you need to do this paleo diet. And so they added meat and they accelerated the illness. They went into kidney failure. I've seen it so many times now. I can't even give you a number of how many people went into kidney failure because they switched to paleo or keto, even worse, and got sicker. So if there's an ingredient in a protocol that might potentially make you sicker, to me, that is not a good protocol yet. It's not optimal, right? Because it should be, if something's healthy, then everyone who does it gets healthier. If some people get healthier and other people get devastatingly sicker, that's not optimal yet. I hope that makes sense, right? Now, if you take the meat out, now you have a healthier diet. So if it's a diet that's plants, so you're doing vegetables and fruits, grains, beans, all that kind of stuff. Now we've removed all inflammatory components, because even meat that's free range still is more inflammatory, still higher in omega-6 and omega-3. You're still getting inflammatory components. You take that out, Now the kidneys are happier, the immune system's happier, and for some people, that's enough. Wonderful if it works for you. And you'll see people all over the internet. I did a plant-based diet, but I still eat grains, I still eat meat, I eat lots of cooked food, and I'm better. Hallelujah, I'm so happy for you, right? Now, for many people, including me, we need more than that because we've been sick so long and our body is a wreck and we need to repair damage at an optimal rate. That's where hypernourishment comes in. Hypernourishment is that overdose of nutrition that optimizes cellular repair and immune function, because that's literally what the ingredients are for. The high levels of nutrients from the vegetables, the omega-3 fatty acids, the water intake, all of those will accelerate cellular repair and optimal immune function. So for some people, again, they add that to their current diet and they get to the finish line. For other people, they have to do that exclusively, like on the Goodbye Lupus protocol, in order to get those results. So what I'm trying to teach you guys is, yes, the optimal way to do it. To me personally, I don't know if it's because I'm a native New Yorker. I like to go, I don't have patience. I want to go the fast track. Give me the fast track any day. I'll do nothing but smoothies. If it'll make me feel good and live, I'm happy, right? But if what you're doing is working for you, great. If you want to take it step at a time, add hypernourishment, start weaning yourself off of other things. And when you get your results and you celebrate that and you keep doing that. So that's, I think, where a lot of the confusion comes from. And I wanted to explain it in detail because I know, Ellen, you're not the only one dealing with that. I'm sure everybody, who's been trying to Google and search and find information on health, it can be overwhelming. How can all these people be right? Well, it's because they have bits and pieces of the puzzle, right? So again, if you're moving along that spectrum where you're taking out some of the really bad stuff and adding more good stuff, you are going to get healthier. And depending on how sick you are, you might get to the finish line without having to be as extreme as other folks. The most extreme way works consistently. That's the reason we when we released our protocol to the public, we did that because we said, this works. Hypernourishment works. The Goodbye Lupus protocol, it just works, right? So you can go all out on that if you want to, or you can, like I said, move along that spectrum. It depends on how much time you have, depends on how sick you are. If you have kidney failure, paleo could kill you because any amount of animal protein will tank your kidney function. So if you have kidney failure, absolutely do not start there. But aches and pains, fatigue, you might find that somewhere along that spectrum might work for you. So I hope that makes sense to you, Ellen, and that helps you, that this is really about the optimal way to eat for cellular function. But lots of folks have tapped into some of these different aspects and gotten good results. It's just not all of their results are because of every aspect of their program, but in spite of some things and because of other things. So I hope that helps all of you guys. I understand how overwhelming it is. That's literally why I do this right now. It's not because I just never want to, take breaks. I just feel very passionate about this and very pressured to continue to deliver this information because there's so many people who are sick. And that's why even when my husband and I decided to release the Goodbye Lupus protocol to the public, it was, we need people to know that this is a resource that they can trust. You don't have to pay for it. This is just, you can have this and use it and get healthy. That's what we want, because you need to save your life. And as my husband always says, you have to save your wife. So that's what I'm here for, is to help you with that clarity. All right. That was long-winded, but again, I'm passionate and I want people to understand. So, all right, let's see here. Let's see, question from YouTube. All right. So Talia Hopkinson says, I'm doing the Goodbye Autoimmune program. Awesome. I have a question. Have you ever seen rheumatoid nodules disappear in your protocol? Absolutely. Absolutely. Yes, I have. Look, see, that was a quick one. Let's do another one. Let's see. Clarice wants to know, I have oncovasculitis and kidney disease. My GFR is 45. My nephrologist said I'll never get better. Any thoughts? My thoughts are, unless your nephrologist is also a psychic who is very well established, you don't need to take that as word. All right. There's always something you can do. And it's just really important that you are fully committed. So as I just went on the spiel about this, make sure you do the full Goodbye Lupus protocol. Let's see what you can get out of it. What I've seen is that nephrologists tend to vastly overestimate their ability to predict your ability to recover or how much of your kidneys are scar tissue based off of things like kidney biopsy. Kidney biopsy is when they take a tiny coin-sized, it's like a little coin-sized piece out of your kidney, and then they estimate that your entire organs, 2 organs, look just like that. And sometimes they'll say you're 50% scar tissue, 80% scar tissue. I've had so many people tell me, in fact, every person with kidney failure that I've helped recover their kidney function has told me that their nephrologist said, no way, there's no getting better. And yet they get better. So you take it as motivation to go all out, right? If you've got 45% kidney function, we need to get you healthy quickly, because if you continue to drop, you're on the path to dialysis and kidney transplant, and you don't want to go there. If you need to survive, do it. But if there's any way to avoid that, do it. All right. I actually just got off the line with someone that I absolutely adore. She was in one of my rapid recovery groups. She had nephritis, and her kidneys, she had lupus nephritis. Her kidneys went back to 100% normal in my group, 100% normal. Then after my group, she got married, she got off plan, she started eating badly, then she got COVID and her kidney function went down. And now we got to get her back on the plan again, right? And that was the conversation I had, is do not mess with the kidneys, right? Let's get you healthy again and get you to stay there. Because even when your kidney function goes back to normal, you don't like go back to pizza. No, there's a step down protocol, right? Where you're still eating only healthy plant-based foods and hypernourishment. And you do not mess around for at least 6 months or more, because it's just barely better, right? It's like the difference between a scab and scar tissue, right? The scab is delicate. You can flick that off just accidentally and be bleeding again. So you have to be so careful. So we know it works, but you do have to lock it in. So go all out. Get yourself, I mean, if you can get up to 60, it's considered normal for your GFR. Go all out and let's show your nephrologist what you can do, right? So let's do that and see. But absolutely, this can help you. How much kidney function you can get back, I can never predict that. I don't pretend to know that. All I can say is this will optimize your ability to recover as much function as possible. So go all out until you hit a plateau and say, here's my max, here's my peak, and then you'll know when to do step down. Okay, let's see. All right, and then Linda wants to know, is there a reason to be concerned about lead in dark green leafy vegetables? Not that I've seen. I mean, I hear about these theories all the time. But if people are getting lead poisoning from dark leafy greens, first of all, I'd have it. My kids would have it. Everyone who's worked with me would have it. It's like the whole thing with oxalates. If it was a problem, we would all have kidney stones. We would also all have lead, and I haven't seen it be a problem. Is it possible in certain areas that there could be a problem? It's always a possibility theoretically, but I haven't seen it be a reality. Okay. Okay. Let's Instagram, see what you got here. All right, so my dental portfolio says, I need help. Can you tell me why I'm feeling so tired post 4 weeks protocol? I can't, because I have no idea what you're doing, what you're battling, how much you're sleeping. So these are the kind of questions that I wish I could dive into my device and like looking at you and see your kitchen and tell you. I don't know. So one, tiredness. There's a lot of reasons why people are tired. The most common reasons for fatigue are malnourishment, dehydration, and not enough sleep. So if you got any of those problems going on, you will be tired, right? Now, sometimes people will say they're on the protocol, but it's not 100% right. And I see that all the time when people do wellness appointments. It's 75 minutes. I go through everything about your history and what you're doing, what you're eating. And every time people will tell me, I've been on the protocol this long, but then when I go through the details, most of the time they're not fully on it. They've added more nutrition and some smoothies, but they're not fully on the protocol. So one, make sure you're fully on it. Make sure you're getting enough sleep, right? And sometimes people can get tired initially when they first really get going on it, because you know your body needs the energy for repair. So if you're tired and you're fully on the plan, make sure that you're getting whatever sleep. The tiredness is your body requesting sleep. So listen, give it sleep and try not to judge it. But if you're struggling to get better, then it might be better to work with me directly so I can see what you're doing, identify the other stressors in your life, and let you know. Because the other thing that really affects energy is your mood, right? So if any of you have ever had anything stressful happen to you, which I'm guessing if you're listening to me, you know what stress is. If you're stressed, if you're anxious, if you had a fight with your best friend, you'll be tired from that too. So that's the other side, would be your self-care, your emotional health would also have a big impact on your energy. So that would be my overview, since I can't get specific and see you, and hopefully something in what I said just rang a bell for you. Okay, let's see here. Okay. Music wants to know, can you share insight into why an elderly person who's always been physically fit may start losing muscle mass drastically while lab work is all good? Will this diet further weight and muscle loss? Okay. So most of the time, if somebody's losing muscle, then it's either from inactivity or from taking something like a corticosteroid. Those are the most common reasons why there would be muscle loss. If you're physically fit and nothing about that has changed, then one, I don't know if it's actual muscle loss, right? So I don't know how you're deciding it's muscle loss, right? So when you say muscle loss, I don't know if that means I feel weaker than usual. I don't know if that just means I have less tone than I used to see. It's a very difficult thing to quantify how you're determining if there's muscle loss. So one question I would have would be, make sure that you know that for sure it's muscle loss. And again, did you change your workout routine, right? If you've been doing less workouts, you're going to have less tone. And could have some muscle loss. If you had to take steroids for any reason, that could cause it. My protocol will not cause muscle loss. It will not. Could it cause weight loss? Yeah, but it will be fat loss. And if you're doing the really strict raw Goodbye Lupus protocol, okay, that'll be fat loss and maybe some glycogen, which is temporary, but it won't cause muscle loss. You can work out and get stronger even while eating nothing but the raw foods. So I would just want to dig into that a bit more to see what's actually going on. As I started this session in the beginning, sometimes the assumptions we make are incorrect, and then it leads us down the yellow brick road totally into a different area than we really needed to go down. All right, let me see here. Okay, all right. Thomas isn't here to answer, but I'll answer. It says, I've heard you and your husband say that oatmeal is fattening or not a good health food. Can you explain why? Also, can hypernourishment help with water retention in the thighs, buttocks, and hips? Okay, so I remember when this happened. This was years ago. My husband posted one day on his Facebook, because we're over 40, that oatmeal is not a weight loss food, and vegans lost their minds. Like, he got unfollowed and unfriended. Like, how dare you attack oatmeal? And he's like, I didn't say oatmeal isn't tasty. I didn't say oatmeal is not something you could use for things like muscle building. I just said it's not a fat loss food. And so it's not a fat loss food. So you're more likely to stimulate your glucose levels will go up, insulin will go up, and that directs your body towards fat gain. Now, if you're doing a bodybuilding workout where you're lifting super heavy weights and doing squats, oatmeal, most of it's going to go towards muscle building, although you'll still get a little fat gain. Anytime you spike those insulin pathways, you can get some muscle gain, but you're also going to get fat gain. So that's just kind of how it is. If you're doing the workouts, you'll get more muscle gain. If you're not working out, you get more fat gain. That's just how it works. A lot of times I'll see people who really are trying to lose weight on a plant-based diet. And when they come to me, they're eating rice, beans, oats, potatoes, all that kind of stuff. And they're like, I don't know why I'm not losing weight. I'm like, that's what I would eat to gain weight. So that's all it is. So it's not saying that, that it's a bad thing. It's just saying that if your goal is fat loss, that's not a good choice. If your goal is healing, it's not a good choice either. Because again, if I say something is healthy or health promoting, it means by eating it, your health goes up. I have not seen that somebody needed oatmeal to make their health go up, but I have seen that taking oats out help people heal faster when they stuck to more of the hypernourishment foods. So again, if something, I need to see 100% of the time that this works in one direction to say it's this, right? If it's a health food, your health goes up when you consume it. Now, if someone switches from eggs for breakfast to oats for breakfast, does their health go up? Yes. But remember, you don't want to assume the reason. It's not because oats are making you healthier. It's because not eating eggs is making you healthier. So that's the reason, is that we've tested these things to see what happens in people when they consume them. And we want to make sure every single time you consume something, it promotes health for us to say it's healthy. Okay. Now, the other part is, can hypernourishment help with water retention? So I don't know why you would be retaining water in your thighs, buttocks, and hips. That doesn't make sense to me. Usually if someone has water retention, then they have some kind of imbalance. So one, you have a kidney issue, a heart issue, right? Those kind of things are more likely to cause edema, but not usually in the buttocks unless you're sitting all the time, and that's where gravity takes it. Most of the time when people have edema, it goes into the ankles because gravity will pull it down to the lowest area, or sometimes you can get into the lungs. So again, it makes me wonder if this is really water retention or if it's something else, because it doesn't make sense to me that it's water without more information. So if it's a kidney issue or heart issue, then yes, it can help. But again, it doesn't make sense to me why you would have water retention there. So maybe there's another way to describe it that would make more sense to me. But biologically, that's not resonating with me, so I can't explain it. Okay. Is your protocol good for type 2 diabetes? Yes, absolutely. Most folks that I see with diabetes are no longer diabetic within 4 weeks. That's the average, is 3 to 4 weeks. I have someone in my rapid recovery group right now. I think we're on day 10, and his blood sugars are all like 100 to 111 with type 2 diabetes already. So if you are doing this for type 2 diabetes, make sure you are testing your blood sugars every day so you don't actually overdose in your blood sugar medications and end up being hypoglycemic. That could be an emergency. Whether it's blood sugar or high blood pressure, you have to test, because those things come down so quickly in my program that you might make yourself sick by overdosing in your meds. So make sure you talk to your doctor if your numbers are good so they can tell you how to adjust your medicines. And you don't actually, it's a good problem to have, right? Is that you're doing too well to need your medicines, but it definitely doesn't feel good to take more than you need and tank your blood pressure or your blood sugar. Okay, Instagram. All right, SP29 map. Severe thirst with lupus, is that reversible? I don't know why you're thirsty. It might just be that you need more water. I mean, usually if you're thirsty, you need it. Now, there is a type of issue that happens with the brain that could be that where someone thinks they're thirsty when they're not. So that would be a neurological thing. And I want to make sure that that's not the case. So one, I would want to make sure that you don't have any other reason going on. Sometimes people will think they're thirsty and they're not, but that's not, it's a very rare disorder. I mean, most people have never heard of it, diabetes insipidus. It's neurological, and people think that they're thirsty and they're not. It is so rare, I have never seen it. I learned about it in medical school. I have never actually seen a patient who has it. So assuming it's not that, and you are thirsty because you need more water, you can just be thirsty. So you could be thirsty because you're not drinking enough water. You could be thirsty because you're having more salt than your body needs and you need water to dilute it. So sometimes people are thirsty because they have drying of their salivary glands. That's more in the autoimmune, maybe Sjogren's. And so they're thirsty because their mouth feels dry and they have more thirst that way. So in general, unless you have that rare issue, thirst just means drink more water. More water helps with reversing autoimmune disease. So for most folks, I found 96 to 128 ounces works very, very well. There are some folks who can drink more than that. And I usually say, base it off your thirst level, right? If you have a gallon of water and you're thirsty, your body's using it. Sometimes, especially athletes will find that. But you can check your blood tests, and if your sodium levels are within normal range, then you're fine to drink more water. But if the thirst is because of dryness, then improving the health of your body and your glands can definitely improve it. So again, I don't know what's driving the thirst, but in most cases, drinking water is the answer. Just like when you're tired, sleeping is the answer. So without knowing you better, knowing more about the cause of it, that's the best I can do, but I hope that it helps. Okay, let's see here. Okay. Let me see here. Oh, this is a quick one. Teresa wants to know if you're sensitive to histamine, what can you do? You can do a low histamine version of this. Chia instead of flax, low histamine choices for fruits and vegetables. Totally doable. We have people do my rapid recovery group that way all the time. Oh, by the way, I did set a date. The next rapid recovery group will be May 19th. So that one's already enrolling for people who already know that you need my daily help to do this. Okay, let's see here. And Jill wants to know, do you eat fermented vegetables? Sometimes. I like some sauerkraut. My family's from Poland. I can enjoy some sauerkraut sometimes, but not on a daily basis. I don't normally do that. Okay. And let's see one more on this side. Is apple cider vinegar approved on the Goodbye Lupus protocol? Do you know a source for organic ACV without the mother? Yes, it's approved. And no, I don't have all the brands for you if you don't want the mother. I don't know, but yes, it's approved on the protocol. All right, let's see. What can we do? All right. Val West wants to know, when does the cookbook come out, or really the uncooked book? It's closer than ever. I get asked this every time. It is right now in the stage of both the designer has it for making it pretty, and we're doing the editing at the same time to make sure all of the measurements and everything are right, because some people contributed from other countries, different measurements. So we're doing that right now, but it is really close, and definitely this year, but hopefully in the next few months, because we just need to coordinate all that coming together. And we're very, very close. I'm excited. But I promise I will let all of you know. You will know. And again, you don't need those recipes to be able to do this. You can literally use smoothies and salads, but I know a lot of you want more fancy, more fun, and I'm doing it for you. I'm doing it for you guys. I was just talking to Chef AJ yesterday, and she's like, we were talking about like how people don't realize what it takes to put a book out and have a full-time work and everything else. It's a lot, especially because I don't want it to be crap. I want it to be nice. So, okay, let me see here. But it's coming. It's closer than ever. It's closer than ever. Okay, let's see who's next. Let's see. All right, some of these questions I just can't answer, but I want to let you know I see it. Like Sylvia, why am I still slightly anemic if I'm consuming all these greens? I do 64 ounces of smoothies and I drink it all. I don't know, because I don't know the reason for your anemia. I don't know if it's iron deficiency, B12 deficiency. I don't know if you have some other kind of genetic issue. I don't know what else you're eating besides the smoothies. So I don't know. If you have a deficiency like B12 or iron, then use a supplement to fix it so you can get it back there. I also don't know what slightly anemic means, because for many people, especially women, tend to have lower hemoglobin and hematocrit. Just women have periods and other things, and yet they feel totally normal. So I don't know if it's pathological or within normal function range for people, even if it's slightly off on your lab. I don't know all those other answers. So I don't know is the answer. And I don't like to pretend when I don't know things. I do the best I can, but look at all those different things and see what you can do. And again, I do everything I can this way to help people get on track. And there's still some people I won't be able to get answers to without getting to know you. So in those cases, I might actually need to meet with you for an appointment or something so I can figure it out. And I'm happy to do that. But there's a limit to what I can do over the internet. I'm trying my best though. Let me see. Brenda said, I'm on day 22 of Goodbye Lupus protocol. I have high cholesterol, high blood sugar, restless leg syndrome, hypothyroid, celiac. How long does it normally take to see a difference? So normally there's some kind of changes that you will see. I mean, I can, when it's in rapid recovery and I'm watching people every day, it's easy for me to know if they're doing it right and say, okay, this is when you should expect to see some differences. When people are doing it on their own, I have no idea if they're really on the protocol, if they're doing it 100%, if they're giving themselves cheat days, if they're under eating by accident. I don't know. So I'll base it off of everything's dialed in and correct. Then normally you can start to see differences. Usually, I mean, some people will start to see differences in the first week or second week, but usually by the third week where you are now, there should be some shift. You should see cholesterol coming down. You should see blood pressure coming down. With the thyroid, I'd want to track antibodies because we don't know how much thyroid function you can get back, but we can definitely watch the thyroid antibodies go away from hypothyroid. Celiac disease, I've usually seen reversal in about 4 weeks, typically. So again, it depends on how aggressively you're doing it and whether you're getting it all right, but you should start seeing changes by this point if you are. Okay. Let me see here. All right. Jessica says, how come I have a positive ANA, but the rheumatologist says I don't have lupus? I also have an elevated anti-C1q. Everything else was negative except Hashimoto's. And he says it's possibly related to Hashimoto's. Also, I have a 2.15 protein creatinine ratio, and then it dropped to 0.51, but they have me leave urine. I'm so confused. So when it comes to diagnosing autoimmune disease, it is based off of a combination of the labs and the symptoms. A positive ANA does not mean that you have lupus. Positive ANAs happen at a fairly high level in the general population and can happen in many different autoimmune diseases as well. Sometimes it'll say positive on the lab test, but rheumatologists don't consider it positive. So for example, a lab test will flag a 1 to 80 or 1 to 160 ANA, but rheumatologists don't consider that positive. Why? Because a lot of the general population can have an ANA of 1 to 80 or 1 to 160 and have no symptoms of autoimmune disease and never will. So they don't consider it positive, even though the lab is showing it as positive. Now, once it gets up higher, like 1 to 320, 1 to 640, they'll say, okay, for sure, 1 to 1280, those are positive ANAs, fine. And still, they're going to look at your symptoms and the rest of your exam to figure out, does this really fit into any of the autoimmune diseases we know of? So, sometimes people will have positive markers and feel okay. Other times people feel like garbage and their markers don't really tell them much at all. So I always focus my diagnosis and treatment on the person in front of me and how they feel. Because if someone feels sick and their labs look fine, well, we just don't know what it is yet. But I'm not going to tell someone when they're fine when they feel like crap, which happens more often than it should. So with you, I don't know. So it could be that the ANA is not actually as positive as you think. It could be that it is positive, but the other labs or your symptoms don't correlate with lupus yet or at all. I don't know. So and also if you have Hashimoto's, which is an autoimmune disease, that could also be related to the ANA, right? Or other issues. So that's the other thing I see is a lot of times people will tell me I developed lupus or RA, 2 years ago, when I asked them, when did the autoimmune start? But then I'll look at their chart and I'll say, no, but Hashimoto's, when did you get that? Oh, 15 years ago. That's when the autoimmune started. You have autoimmune disease that you've had the whole time. It's just doctors don't talk about it as autoimmune, and people often don't even realize that they have untreated autoimmune disease. They're just taking a replacement for their thyroid and they have untreated autoimmune disease. So if you have Hashimoto's, you already have autoimmune disease. Whether or not it's developing lupus depends on all those other things I mentioned. Either way, do my protocol and that will help with all of those things. And hopefully you'll be feeling better a lot sooner, and it won't matter what the rheumatologist diagnoses you with. Better to heal before you even get the diagnosis. Okay. All right. Zadie says, I'm having dizziness really bad. Make sure you see your doctor, because I don't know what it is. Again, I can't see you. I don't know what your labs say. I don't know what's going on with you. Do you have something going on with your inner ear? Are you sodium deficient? Do you have a bad sinus infection? I don't know. So if you are having a symptom that is making you feel very sick, very uncomfortable, very dizzy, please go and see a doctor. I can't do that from here. I wish I could. Believe me, I would be everywhere at once if I could. I just don't have that ability to do that. So if you need to be diagnosed as to why am I feeling these symptoms, go to your doctor and find out. If you're so dizzy you can't stand up, you feel like you're going to fall down, go to the emergency room, find out, right? Sometimes people get dizzy because they are sodium deficient and that's all they needed is an IV and they're back to normal. I don't know. So make sure that you go to your doctor and find out the cause for what you're going through, okay? Let me see here. All right. Rain Hardress Mary says, what types of kale do you use in your salad? There's so many types available. I'll take any. I think for my salad, I like the curly kale the best. So I like to do the curly kale and then I'll massage my dressing into it and then I'll add the other toppings to it. So that's usually the one I use in my salad, but I'll eat any kale. I'm not picky about that. Okay. Let's see over here. All right. And then Clearly Nature said, I'm starting the protocol Monday. Does it help with adrenal fatigue and insulin sensitivity? Absolutely. Dealing with chronic shingles due to COVID for the last 2 years. I have RA and Lyme. I had somebody in my last group who's had chronic shingles for so many years. I'm trying to remember the exact amount of years now. I don't want to get it wrong, but many, many years. And he was getting the internal kind and suffered so much. He's had a low immune system since he was a child. And during the 6-week group, he stopped having all shingles outbreaks. He had no infections, where he usually goes from infection to infection. His immune system started working again. And it had been since childhood that it hadn't worked. So 100% I'd be doing this. And hopefully you'll be feeling a lot better soon. So the RA, the adrenal fatigue, insulin sensitivity, chronic shingles. Yeah, you're on the right path. My question is, why start Monday? It's Wednesday. Start today. Start today. It's worth it. Don't treat it like you're going to prison and have a last meal that makes you sicker before you start. Like just start. Just start. It's worth it. It's your body. It's your health. Just start. Okay. Let's see here. Okay, Lonnie. I have an autoimmune disease, dermatomyositis. Current blood tests look good. My doctor said I need more protein to build more muscles. Where does your protein go after the first 4 to 6 weeks? I'm blessed by help of doctors who are favorable to your premise. You don't need more protein to build more muscles. You need more exercise to build more muscles. So if you've already done my protocol and you're symptom-free and your blood tests are normal, then give yourself about 6 months before you introduce anything that could provoke any inflammation, because you want to lock it in. And if you want the healthiest way to build muscle, like build muscle size, like you're trying to get buff and huge. I'm going buff, but like I'm not buff. I'm toned, but I'm not buff. If you want to get big and buff, then I would follow my husband's protocol in his Miracle Metabolism book, Miracle Metabolism by Thomas Tadlock. He tells you how to go from my protocol into a muscle building protocol. If, however, you're not trying to get big and buff, you just want to get stronger, all you need to do is strength training exercise and you will get stronger. That's all you need to do. If you do strength training exercise, you'll get stronger, and you'll get stronger faster on my protocol than you would any other way, because the nourishment will keep inflammation low, and your cells are so responsive, you'll get stronger much, much faster. Okay. Let me see here. Okay. Teresa says, COVID messed me up so bad. I've been doing hypernourishing shakes for months, but I still don't feel good. I'm wondering if it's because I'm now histamine intolerant. Easy thing to test. Easy thing to test. Also make sure you're doing more. So hypernourishing smoothies is a good start, but if you're not getting better, you need to go all in on the Goodbye Lupus protocol or Goodbye Autoimmune Disease protocol, get your whole lifestyle set. And if still that's not doing it, then histamine is something worth testing as well. All right, let me test. All right, let's see here. Instagram. Megan Capel. What is the best food for having one kidney and keeping your kidney healthy and GFR up? Plant-based diet, hypernourishment, right? So you can do just fine with one kidney. In fact, that's why kidney transplants are successful. You keep one, you give one away. If you want to keep it healthy, do not eat any animal products. Meat is very stressful to the kidney. It puts it into a hyperfiltration mode that puts a lot of strain on it. If you don't want to put any strain on your kidney, then just stay away from all animal products. Eat a plant-based diet. Keep hypernourishment as part of your diet, and you'll keep your kidney healthy, and you also keep your whole body healthy. There's a reason I still eat this way, is because I like being healthy and strong. You know, I like aging in a healthy way. And it's beyond even just appearances. Yes, it's nice to look younger than your age. I care about that much less than the fact that my colon apparently I have a teenage colon, according to my GI doctor, did my colonoscopy, right? Have my mammogram. Apparently my breasts are also very young because of the tissue in there, that that all of the different organs of my body are younger. They look like I'm 30 years younger than I am. Why? Because hypernourishment. So it's a way that you can keep all of your organs healthier. And it's not just about aesthetics, but it's about life. You know, I want to maximize. I want to go all out and just get as much life as I can. That's what I'm aiming for. So that's why I just keep these flowing, and I keep doing everything I can to have a life that makes me happy and fulfilled. I get my sleep. I eat well, because life is good. And I know what it's like to be on the other side, where life is just terrible and I'm exhausted and sick all the time. I'm all in on this for the rest of my life because it works and I feel good and I'm young on the inside. And that matters more to me than anything else, right? And I want that for all of you guys too, 100%. Okay, one more round here, and then I got to go and see the next person who's going to be waiting for me. Let's see. Okay, Deborah wants to know, is plain unflavored soda water from a soda stream okay to drink? It is not on plan for healing. So any carbonated waters, any carbonated drinks are not on plan for healing. I have a friend who's a hygienist who says carbonation is the worst stuff for your teeth. It's also going to make your body more acidic. So it is, if you're healthy, having something with carbonation once in a while, you probably get away with it. But if you are struggling with health problems, then take it out, go without the bubbles. Okay, let's see. Last YouTube one. Okay. All right. Okay. Oh, I see. This is a two-part question. So Halcyon says, I have food sensitivity test says I'm intolerant to certain nuts, citrus fruits, and flax seeds. Can I ignore this and do your protocol and continue with the raw food diet afterwards, or do I still need to avoid? So I don't know what's the fastest answer. I don't do food sensitivity tests. I just see how people do. And if I see a reaction, I'll change something because I haven't seen a good correlation between those tests and what I see. So again, results matter to me. But if you've had a test done, go with it for now. Use chia instead of flax, avoid the citrus fruits, and just do the protocol without it. You can absolutely stay raw. Raw foods definitely give the most energy. I love doing raw eating. So you can definitely continue with that. And usually the sensitivities will go away in a healthy body. So I see a lot of folks where they have sensitivities and allergies and they don't have them anymore after continuing on and finishing the healing process. So follow the tests for now, get yourself healthy, and then test reintroducing them and see how you do. All right. And for Instagram, let's see. All right, I'll do two just because these are so short. Is it okay to be on protocol with diabetes? Yes, I've had great results for type 1 and type 2 diabetes. Definitely. Great protocol for that. And the other one is Lighthouse Grammy. Are excess omega-3s good for weight gain or weight loss? They are great for optimal metabolism. So that means if you have a fast optimal metabolism, then if you are trying to lose weight, you're doing, high intensity interval training, you're going to lose fat. If you're trying to build muscle, you're going to build muscle faster. So that's what you want. But the higher the omega-3, the more optimal your metabolism. They will not cause weight gain. You cannot get fatter on omega-3s. You cannot. So they will create a fast metabolism. And for most people, that's going to mean fat loss. But if you're putting it as part of a bodybuilding program, you'll have faster gains as well. So, all right, everybody. So great to see all of you guys here again. I absolutely love all of these questions, and I hope this is helping you. Let me know if you're continuing to get a lot out of this. I know it means a lot to me to do this, especially since I've been getting messages lately saying that the answer that I gave here was what they needed to finish healing. My goal is this just becomes the normal way people live, and you don't need to go to the doctor so much. You don't need special protocols because it just becomes normal. But until then, I'm going to keep fighting for you, and I'm going to keep showing up for you. And I hope this makes a difference for you. So, all right, everybody, I will see you next time, next Wednesday. I hope all of you have a great rest of your week.